your health this afternoon. The change in the weather and the change in season is often accompanied by an increase in illnesses.
Many of those are blamed on respiratory viruses. Us to talk about this is Shamal Majithia, medical director with the Western New York Immediate Care. Doctor, thank you for being here.
Thank you for having me.
We were just talking, interestingly enough, during the break about kind of how this season is setting up in terms of what trends medical professionals are seeing. And you're saying, you were telling us during the break, you're really not seeing that much yet.
Yes, in terms of like the major illnesses such as like RSV, flu, a little bit of a delayed onset lately, especially in Erie County area, like we were discussing, probably due to maybe the warmer weather. Viruses tend to like colder climates. You know, your nose gets cold in the winter. It's a perfect climate for viruses to enter. You lose some of that barrier to block them out, and that's when we see kind of a rise and stuff like that.
You mentioned the weather, and of course viruses, they love the holidays, they love family gatherings.
That's
right.
When do we typically see the peak in these viruses?
So, you know, in the wintertime, we have a bunch of holidays like Thanksgiving, Christmas, New Year's, so a lot of mass gatherings. Lately, we have the Taylor Swift concert.
That's true, yeah.
So a lot of those type of things kind of add to that ramp up of the viruses. Kids going back to school and being more in a group environment also contributes to that as well.
So I imagine, given the fact that we've got maybe a little bit of a delayed season this year, we now have some time to protect ourselves. So what steps should folks take?
Yeah, main thing is, so, you know, it's always a tried and true thing is a hand hygiene. If you're feeling any sort of sickness or illness, masking is also very helpful. That will prevent spread to your children, your, you know, families and those kind of things as well. Staying home when you are sick to help, you know, other people not get sick. And then, you know, if you think something is wrong, just come get checked out. We're always good to be there to reassure you that it's nothing serious, it's just a cold, or to, you know, take the next steps that you would need.
You led me to my next question. You know, when talking about the different symptoms, there are people when they have a sniffle, they go to the doctor, and then there are those people who rarely go to the doctor.
Yes.
When should you seek help?
So it's a lot of different things. You know, we usually tend to say if you have trouble breathing, if there's a fever, those kind of things. It's always helpful to call your doctor and ask. They may just say go to an urgent care, which that's why we're here, because sometimes they're so busy they can't get you in. And some people just want that reassurance that, hey, this is something that's going to last a couple days. I just need to take some cold and flu medicine and we should be fine. Or there's something more. It's a good thing that you came in. We can figure it out from there.
Can we talk about the efficacy or effectiveness of the immunizations this year? We've got COVID, we've got RSV, we've got other things that are out there.
Yeah.
Are they effective, and what are you guys seeing?
So they're effective in at least preventing, you know, severity of illness, right? So the flu, they tried a bunch of, you know, the private sector, CDC, FDA are all involved in designing what the flu vaccine is going to be that year. Viruses always mutate. It's hard to be exact, but it definitely shows efficacy. It's a tried and true vaccine as well. COVID also as well. And now there's a new RSV vaccine.
Exactly, and that's up there on the screen right now. We were talking, and Brian was moving through, our director was moving through some of those graphics, and it actually said there were new guidelines for some of these vaccines. Is that correct?
Yeah, so it's mostly age-related guidelines and medical condition guidelines as well. So the main thing is the RSV in children has been quite the contributor to like a lot of respiratory illness and stuff like that. So with this new vaccine that newborns can get, or even pregnant women are being recommended to have, just to pass on those antibodies to their newborns, has been quite helpful in, you know, preventing illnesses and stuff like that. Because families, you know, you'll have someone in daycare and you'll have a newborn, and it's really hard to keep them separate. Yeah. I have that exact problem right now.
Yeah, so,
you
always
know,
sick.
Yeah, so.
Some of the other viruses, what are the at-risk individuals? What should they, higher at-risk individuals, I should say, what should they keep in mind?
Yeah, so I mean, any individuals, so we mentioned like newborns, people who have low immunity, some of the elderly have low immunity, but then also people who have like asthma, COPD, any respiratory problems. There's diabetics out there who have a lower just immune system in general. So it's definitely important to talk to your doctor about which vaccines are safe and effective for you and recommended because of your different or your unique medical illnesses, and then that should be helpful from there.
Excellent. Dr. Majithia, the medical director with Western New York Immediate Care. Doctor, thank you for being here.
Yeah, appreciate it. Thank you guys.